time. Co-moderating with me is Dr. SHUBHRA GOEL, a hardcore ocular aesthetic surgeon. Besides all her oculoplasty forays, I'm sure we all know that she's an immensely versatile person with a huge experience in this field of ocular plastics in ophthalmology, practicing in Apollo Health City, Hyderabad. Needless to say, she's going to steer this webinar with her amazing moderating skills. Rather, should I say that she's going to set the stage on fire with her opening talk on the avatar of an ocular aesthetic surgeon, my key takeaways. On to you, Dr. SHUBHRA.
Thank you so much, ma'am, and a warm welcome to one and all. I'm so blessed and so honored to be amongst the best of the best in ocular aesthetics. And rightfully said, ma'am, I think we're going to set the stage on fire and we're going to take everybody make more interested in ocular aesthetics. So when you gave me the talk on avatar of an ocular aesthetic surgeon, I was actually confused because I was wondering whether I should take this talk how should I mold this talk so that more and more people get attracted towards ocular aesthetics and this specialty actually becomes one of the mainstreams, which it is, but it needs a little more effort and a little more awareness. So welcome to all on the update series of ocular aesthetics. I think this is a great step by the ARC series and All India series to bring forth the aesthetic practice, which has been increasing manifold. Thanks to all the pioneers and pillars of ocular aesthetics who are there as part of this meeting as well, Dr. Kasturi, Milind, Debraj, and my colleagues and friends from all over the country. Well, when you say aesthetics, I'm just going to take you briefly through my journey of how I turned from an ophthalmologist to an oculoplasty and then to oculofacial aesthetics. Because actually the beauty or the aesthetics is not something new. It belongs in each and every part of what we deal with in our life, whether it is your home, your pets, or even a beautiful cake, which I think I made for my better half. I hope he appreciated what I did for him. So beauty is everywhere, and it's only that we have to mix the science and art together and understand that we are just the right and left halves of the same individual, and we all have it within us. So when you look at my journey, I mean, obviously we all here present have been ophthalmologists. And while doing ophthalmology, at least I wasn't aware that there was a specialty called oculoplastics. But as a resident, I always wanted to do general plastic or plastic surgery. And then this kid of plastic surgery was just sitting somewhere very, naive in my system. And I was searching, hunting for it. And thanks to, thank you to the, my seniors, my friends who diverted my attention towards institutes like Shankar Netral and LV Prasad, where I knew that something called oculoplasty actually existed. And that's where I did my fellowships. And while doing the fellowship, I realized that my interest primarily lied in more of aesthetics rather than doing the core oculoplasty work. And of course, I have to thank my alma maters who have made me what I am today, apart from all my other seniors who have trained me every single day. I learn every single day from everyone. And this is just, a way of my thanking to my mentors, because if they weren't there, I wouldn't be sitting here and talking about my journey. Now, it hasn't been easy, and I'll come to that, why shifting from ophthalmology to oculoplastics and then to aesthetics hasn't been easy. But I consider it as one of my most fascinating and exciting journey, apart from the other, journey areas which are there. And it's still an ongoing process where you peel your layers every single day and understand what you need to do in your professional life. So the biggest hurdle or the understanding or the change for me was to come out of my comfort zone of institution to the corporate journey. And it wasn't easy initially because institution was my comfort zone. I was the king or the queen there, and I was getting whatever I wanted to do. This journey taught me a lot, and it actually widened my exposure and the thought processes of how I want to take the ocular aesthetics forward. Stopping doing cataracts was another step, which was a big step taken, because when we started, cataracts was one of the things which we were doing, and everybody came and told me that please don't stop doing cataracts, that's bread and butter. And somewhere I had to decide of not doing it. Setting off an exclusive center in Shankar Netralaya was a big learning experience. It gave me the confidence and the experience to move forward. The awareness for the specialty was not existent when I think Dr. Kasturi, me, Milind, and we all started, because it wasn't looked upon as one of the specialty in oculoplastics or in ophthalmology. So there was a lot of things which we needed to do in terms of spreading the awareness, talking about it. Of course, the allied specialties and our standing amongst them was very weak. And we wanted to prove to the world, and I think Dr. Kasturi and Milind would agree with us, that what is so different we are doing. A lot of people came and said, aesthetics has always been there. What is so different? Why do you want to label it differently? It's just part of oculoplastics. But I think beyond all these understandings and journey, there were new associations, expansive views and connections, new learnings. And for me, especially, I think what made me what I am today, and I'm still on this journey, as I said, is a stronger and focused part of me focusing on that part of the specialty. And that's how I started to, I started Clinica Phi, branding the work I want to do and do it in a way I want to do. And I want to project this specialty in the existing scenarios. The pillars for core aesthetic practice for me actually are surgical and allied. I think we forget a major part, which is allied. And I'm not going to talk much detail about all the procedures, but just take you through a journey of things which, have been my pillars in my practice. And I think the word which I would put here for all the budding ophthalmologists or people who are looking at ocular aesthetics is just look beyond. I mean, for most of the individuals, this face would be normal, but for us, this face is not. And we have so many things which can correct on the face. Now, there would always be a question about, aging gracefully, aging naturally, and we were just discussing about it. But yes, you can age gracefully and age naturally, but few touch-ups here and there makes you age even more gracefully and beautifully. So that's my take home for everything. Of course, the eyelid bags, blepharoplasty, periocular rejuvenation surgeries are a major part of it. I think Dr. Kasturi, Milind, everybody is going to cover it in detail. Hooding of eyelids. And I want to bring your focus on not only the surgical procedure, but the way the emotional quotient on the face of an individual actually changes with the simple surgeries like blepharoplasty and more. And this is one of the examples where the patient had come for blepharoplasty with brow lift. Patient didn't turn up for the post-op clinical picture, but this is what she sent to me. And she's just a housewife who has completely changed her personality after the surgery. Now, this is not me talking about, this is she talking and sending pictures to me. So the personality, the persona, the confidence, and the emotional question for people actually change, and it's pretty evident. And then there are different indications like orbital fat prolapse. And I didn't hesitate to operate on my own mother. And, she is a thyroid patient with hypertension on anticoagulants. And she came here post-COVID and she had nothing to do for 2 months. I said, you know what, mom, let's just make you a little more happening. This is she. Which I just touched her up a little bit. She was pretty upset with me. I still wanted to do the brow Botox, forehead Botox, where she has a surprise look. I wanted to do a little bit of filler on the lower face. I purposely cut her lower face because she has a distorted chin. But this is what gives you the pleasure of treating people around you, making them happy, making them different, bringing that difference in their lives. Skincare is one of the major part of our practices as surgeons, because if the skin is not good, the results won't be good. This is one of the patients who has been on the skincare, and these are real pictures where the skin has transformed over a period of 8 to 10 weeks, where the shine, the glow, the texture, everything has changed. Of course, you can do facial contouring where the square can be converted into V shape with simple things like Botox and fillers and injectables. And I'm sure we're going to have wonderful talks on that. Sometimes reconstructive surgeries do become part of your aesthetic practice, where this girl had prosthetic eye, her brow was not in position, lid was retracting, multiple surgeries being done elsewhere. And this is what we could achieve. And she has a squint in her right eye with a lid ptosis, which is pre-existing. Her vision is limited in the only seeing eye. So we just played around with some Botox and fillers, and this is how she is, after the procedure. Of course, these are my fancy tools where I use a lot of my skin regimes, and newer innovations, newer technologies are always a part of the game. You have to be in the game. You have to have allied, associations where you need to enhance the periocular area in a very, very beautiful way, because your periocular, perioral area is the first thing which gives the impression on the face. And this is me with eyelash extensions. It's not bad idea to do it once in a while and to change the whole persona around you. You can use lash serums, you can do extensions. So this is just a fun picture to show you that, how the personality actually changes with some of the basic aesthetic procedures. Of course, there are non-surgical procedures, and that's where your associations with your, partners or allied services comes in. If you yourself cannot have it in your clinic, or you don't want to do it, and definitely you need some Vaha moments, combination therapies, and soft procedures for our patients. So my quick takeaways from my journey and from what I have learned is that it's okay to stand out. It's okay to be different. People will think that you are different, but it's okay to continue. You are unique, and you need to have the passion intact of what you are doing, because that's what will keep you moving. No matter what experience you have, whether it is good or bad, it's always an experience. It's always useful somewhere in life. A lot of times we fail in what we do, but those experiences teach you a lot and make you a better surgeon, better physician, better person. As I mentioned, step outside your comfort zone. I think that's the biggest step and the most difficult step, which an individual, as a clinician, which if taken really helps. There is no wrong time to do the right thing. Whenever you feel what you want to do, just do it. And, don't get intimidated by your colleagues, your friends, your seniors. Do what you want to do. What is best for you? What are your strengths? What are your focuses? Never hesitate from learning new from anybody, whether it's your student, fellow, senior, junior, mentors. Choose your mentors correctly. And I think they are your, torch holders, and they take you to a next level. Be part of training programs, learn from people who are teaching you. And as an individual, we all love teaching, because teaching makes you a better physician and a clinician. And go beyond. It's not only here that you can give your services. You can give your services wherever it is available, wherever it is needed. You just need to be there as as an individual, giving whatever you have learned over a period of time, because it's just one life. And I think COVID has taught us that, it's all, we just cannot be restricted to one zone, one area. Life is more to that, and our practice. And we are blessed to be oculofacial aesthetic surgeons, because we can bring in so many changes on so many people's life. So keep moving forward, don't stop, and keep working on what you feel is the best for you. Thank you so much.
Thanks a lot, Dr. Shubhra. That was a really an energizing talk. Gave us a lot of insights on what you have done as you have evolved. But as an ophthalmologist, we're all trained to examine a patient in a particular way, right from the lids to the retina. But I'm sure in your specialty, you must be picking up subtle signs which even the patient doesn't know about themselves as what is wrong. So there must be a sequence of examination which you follow. So could you enlarge on that?
So that's a good question, ma'am. See, basically, as an ophthalmologist, the general ophthalmic checkup never stops. The patient enters the cabin with a basic ophthalmic checkup being done. But most of the clients or patients who walk in know what is happening to them, why they have come for us. They may not be knowing scientifically what is the disease process behind it, but most of them are aware of what is happening. And of course, the examination starts from, if I talk about myself, it starts from the upper face, mid face, lower face, which includes the skin, which includes the Brony framework, and it includes the structures in that area. So if we start with the upper face, it includes your forehead and eyebrows, and comes your eyelids, orbit, socket, and everything down. So that's how I plan the examination, go step by step and see what is wrong. and then move forward onto the specifics. So if it is related to eyelids, for example, patient has ptosis, and we go to jump to the ptosis examination. But the point here is it's always the ophthalmic checkup, then the full face checkup, and the specifics of the area which is affected.
Can I add something?
Yes, yes.
Okay. If you go to the textbooks or the basic textbooks of the American Academy, the AIOS series, it mentions that as an ophthalmologist, we are supposed to evaluate right from our forehead to the chin. So this is very pertinent, and it's very important that all ophthalmologists, we should not have a tunnel vision and only look to the eyes, but all ophthalmologists are armamentarium starts from here to here. And that is what in the basic textbook of A also, you'll find the extensive, lectures, chapters on the blepharoplasty, neck leaf, the lasers, everything. So now, like, it has become a part and parcel of our ophthalmic resident training program also.
Dr. Milind, do you have anything to add before I ask my second and last question for this talk?
Clinically, you could primarily divide patients into two broad groups. One kind of patient comes with a problem and they say that we want to fix this, like how Shubhra said, either ptosis or their under eye bags and so forth. The other is a patient who asks you an open question that I don't like my looks, I look tired or I look unhappy. So they use adjectives, and then you finally have to identify certain anatomic features which they can relate to that adjective that they have described. And once you match them, then you can fix the anatomy.
But with the kind of competition that you have, like the beauty clinics and the plastic surgeons and all dermatologists, so how do you show that you are different? Like, how do you differentiate yourselves in your practice?
You don't need to show you're different, ma'am. The moment the client walks in, they know we are different. So I think the way oculoplasty surgeon approaches to the specifics is totally different from what dermatologist or plastic surgeon would approach, with no offense to any specialist. This was just on a lighter note. And I think, as I mentioned, at the end of it, it is all combination services which matters. So I'm very clear that if I'm not able to correct something, this is the person whom they have to go to and get it corrected from. So I think at the end of it, it is a group practice. It's sharing of patients for specifics with the ethics in place. And I think over a period of time, people do understand that what you're doing is in the best interest of theirs.
Anybody on the expert panel have anything to ask Dr. Shubhra before we go on to our next talk?
Yes, ma'am. I'd like to ask a question. Shubhra. First of all, I'm sorry I joined in late, and thank you all. This is such a wonderful forum. Shubhra, I have one question. Like sometimes, like you say, patients come in with a set perception, what they want to look like or what they think is wrong with their face. But what if you feel, very commonly like in ptosis and lid retraction, one eye has retraction and the other has ptosis, and the patient is convinced that it is the ptotic eye which is wrong and not the retracting eye. So do you generally fall in with what the patient wants? Because cosmetic is basically all about making the patient happy. Or do you do what you think is right in such cases?
So, Dr. Kamalpreet, a wonderful question. I think we all, have this issue. So I divide my patient into vanity and non-vanity patients. Patients who are belonging to the category of vanity is where they force you to do what they want to do, and they have unrealistic expectations. Most of the patients who are from the non-vanity group, and I say that, for example, your lid retraction versus ptosis, we know there is a structural issue lying over there and there is a reason behind it. And I think when we explain them scientifically, explain them the outcomes, they do understand. But yes, coming to the other category, it is difficult. I think a lot of counseling goes into it, but at the end of it, doing the minimum is the best, and giving them the realistic outcomes is the best. And if I feel that the patient or the client is not understanding that, it's like Ram Ram, because I don't think I would be ever able to make them happy. I'm sorry for that grammar. Yeah.
Yes.